I'm Dr. Chris Hulen at KSF Orthopaedics, and I'm happy to be here with you today to go over a common condition called cervical myelopathy. And this is a condition that's very near and dear to my heart because I've seen so many patients that have so many problems with cervical myelopathy that have gone undiagnosed or misunderstood for many years. Cervical myelopathy is a condition that causes dysfunction of your spinal cord. What do I mean by that? It's a condition whereby your spinal cord is not able to accurately convey the right messages from your brain to other parts of your body, and it makes it difficult for the person with cervical myelopathy to do commonly performed tasks. The most common cause of cervical myelopathy that I see as a spine surgeon is a compression of the spinal cord that can occur from many different things. It can be caused by a narrowing in the spinal canal that happens slowly over time. It can be caused by an accumulation of bone spurs that develop over many, many years. It can be caused by deformities within the neck that are due to rheumatologic conditions such as rheumatoid arthritis. But the underlying thing that ties all of these possibilities together is that it results in dysfunction of the spinal cord. And as a patient, the way this is typically experienced is that the patient slowly develops difficulty using their hands. They have difficulty with coordination of their hands. They have difficulty with walking in a coordinated manner. They may notice that they're dropping items or stumbling when they walk or tripping more frequently when they try to walk, or that when they're walking with a loved one, they may bump into the other person's shoulder as they walk down a pathway. Or if they're alone, they may be walking in their own hallway in their own home and may notice that they're bumping into the walls, or they're having to hold on to the walls just for balance. So all of these items are very important to recognize. And one of the tragedies that I see as a spine surgeon all too often is that people will attribute these symptoms to simply growing older. And in reality, yes, we're all growing older, but growing older alone doesn't necessarily cause these symptoms. In many cases are due to compression on the spinal cord. So my purpose today is to educate you a little bit about this condition and to let you know that it's important that if you have these symptoms, you should be evaluated by a qualified spine surgeon who can look at your condition, examine you, obtain x-rays, and in some cases an MRI of your cervical spine, and let you know exactly what's going on. So you can be well informed about your condition, and you can have a menu of options to choose from in terms of how you'd like to be treated. But it's important that you do not ignore these types of symptoms, because in many cases of cervical myelopathy, if it's not diagnosed appropriately, it will worsen over time. And we know that with this condition, if it's treated earlier, the results are typically much better. If you are diagnosed with cervical myelopathy due to a compressed spinal cord, there are treatments which can be performed that can dramatically improve your life and can halt the downward spiral in function that you may be experiencing. I would encourage you to come and get evaluated if you have these types of symptoms. Not all cases require surgery right away. And even when surgery is required, sometimes it's a small surgery, sometimes it's a larger surgery. But you owe it to yourself to get the facts so that you can make a well-informed decision. I look forward to helping you, and if you need more information, please give us a call. I'm happy to evaluate you or your loved ones. Have a nice day.